High blood pressure is called the silent killer for a reason. Most people who have it don't even know it. No obvious pain, no clear warning, just quietly damaging your heart, brain, and kidneys every single day. In the next 8 minutes, I'm going to show you the symptoms of high blood pressure that most people ignore, and what you should do if you recognize any of them. Stay until the end, because symptom number 6 is the one that surprises almost everyone. Welcome back. If this is your first time here, this channel is all about giving you simple, clear health information that actually matters in your everyday life. Today we're talking about high blood pressure, also called hypertension. Over 1 billion people worldwide have high blood pressure. That's 1 in 4 adults. And nearly half of them don't even know it. That's what makes it so dangerous. So let's talk about the signs your body might already be sending you. The first symptom is headaches, but not just any headache. High blood pressure headaches tend to feel like a pulsing or throbbing pressure, usually at the back of the head or the temples. They often happen in the morning when you first wake up, and they can feel different from a regular tension headache or a migraine. Now here's the thing, not everyone with high blood pressure gets headaches. But if you're regularly waking up with a dull, throbbing head pain that has no clear cause, it's worth getting your blood pressure checked. Don't just reach for a painkiller and move on. Listen to what your body is telling you. Symptom number 2 is dizziness. This can feel like the room is spinning slightly, or like you lose your balance when you stand up too fast. Some people describe it as a sudden lightheadedness that comes and goes. Now, dizziness alone doesn't always mean high blood pressure, but combined with other symptoms on this list, it's a signal worth paying attention to. Especially if the dizziness comes on suddenly and strongly, that can sometimes indicate a dangerous spike in blood pressure that needs immediate attention. Symptom number 3, blurred or changes in vision. High blood pressure can damage the tiny blood vessels in your eyes. This is called hypertensive retinopathy, and over time it can cause your vision to become blurry or distorted. Some people notice spots or floaters in their vision. Others notice that things just don't look as sharp as they used to. The scary part is, this damage can happen gradually without you noticing, until one day your vision is noticeably worse and the damage is already done. If your vision has been changing and you haven't had your blood pressure checked recently, please do it soon. Symptom number 4 is shortness of breath. When blood pressure stays high for a long time, it puts extra strain on your heart. Your heart has to work much harder than normal to pump blood through your body. Over time, this can weaken the heart muscle, and one of the first signs of this is feeling short of breath during activities that never used to wind you out. Climbing stairs, walking to the car, getting up from the couch. If you find yourself getting breathless during simple everyday activities and you're not sure why, high blood pressure could be playing a role. Symptom number 5 is chest pain or tightness. This is one you should never ignore, ever. High blood pressure puts enormous strain on your arteries and heart. Chest pain or tightness, especially combined with shortness of breath or dizziness, can be a sign that your heart is under serious stress. It could indicate angina, which is reduced blood flow to the heart. Or in more serious cases, it could be a warning sign of a heart attack. If you experience chest pain, stop what you're doing, sit down, and if it doesn't pass within a few minutes, call emergency services immediately. Do not drive yourself to the hospital. Call for help. And here's symptom number 6, the one that surprises most people: nosebleeds. Yes, frequent or unexplained nosebleeds can be a sign of high blood pressure. Now, occasional nosebleeds are usually harmless. Dry air, allergies, minor irritation. But if you're getting nosebleeds regularly with no obvious cause, especially if they're hard to stop, that's worth investigating. During a hypertensive crisis, when blood pressure spikes to dangerously high levels, nosebleeds can happen suddenly and severely. If you have a nosebleed along with a severe headache, chest pain, or vision changes, go to the emergency room immediately. That combination is a red flag. Symptom number 7 is fatigue and difficulty concentrating. When your blood pressure is consistently high, your brain doesn't get the clean, steady blood flow it needs to function properly. This can show up as constant tiredness, even after a full night of sleep, or brain fog, where you struggle to focus, remember things, or think clearly. Many people with uncontrolled high blood pressure report feeling mentally sluggish or exhausted without understanding why. If you've been feeling unusually tired or foggy for weeks and you can't explain it, blood pressure is one of the first things you should check. Now let's talk about who is most at risk for high blood pressure. Age is a big factor. As we get older, our arteries naturally become stiffer, which raises blood pressure. A diet high in salt, processed foods, and unhealthy fats is a major contributor. So is being overweight, not exercising regularly, smoking, and drinking too much alcohol. Stress is also a serious factor. Chronic stress keeps your body in a constant state of tension, and that directly impacts your blood pressure. And genetics plays a role too. If high blood pressure runs in your family, you need to be extra vigilant. The good news is, most of these risk factors are within your control. Here's what you can start doing today. Get your blood pressure checked regularly, especially if you're over 40 or have any risk factors. Home blood pressure monitors are affordable and easy to use. Reduce your salt intake. Cut back on processed and packaged foods. Exercise regularly. Even a 30-minute walk every day makes a real difference. Manage your stress through sleep, breathing exercises, or whatever works for you. And if your doctor has prescribed medication for blood pressure, take it consistently. Don't stop just because you feel fine. Let's do a quick recap of the symptoms of high blood pressure you should never ignore. Number 1, headaches, especially in the morning. Number 2, dizziness or lightheadedness. Number 3, blurred or changing vision. Number 4, shortness of breath during easy activities. Number 5, chest pain or tightness. Number 6, frequent unexplained nosebleeds. Number 7, constant fatigue and brain fog. If you recognize any of these symptoms, please get your blood pressure checked. It's quick, painless, and could genuinely save your life. Share this video with someone you care about. You never know who needs to hear this today. If this was helpful, hit subscribe. I post new health videos every week. See you in the next one.